I'm a consultant anaesthetist in the UK.
Because, at my institutions, we are different departments. So we have many anesthesia and intensive care departments.
When I was choosing faculty to enroll in, I didn't actually think I was going to study or practice medicine.
And I began within the School of Anesthesia and Intensive Care in Bologna. And I realized that was my feelings.
From a very young age, I understood that a career as a physician would be one of service and one of compassion, and this is exactly what we need right now.
In those months, we were able to reorganize our hospital, and I am convinced that our specialty is the real answer to this wave.
So we were overwhelmed. Also, we saw patients coming in with more difficult diseases and in much worse shape than they would have come before.
Well, the most obvious incursion is the increased working hours. So many aspects of not just their professional but their personal lives. We quite often forget that there are many other workers than just doctors and nurses on the front line.
We ended up working non-stop, basically 24 hours shifts and stuff like that.
For a period of time, we were completely overwhelmed. Professionally, I've never seen anything like it, and at the height of this, in March, April time, when it hit, it was almost like a war zone. So we had no capacity at all to accommodate these patients unless we overspilled. So it was a scary time for all of us, and uncharted territory for most of us as well.
It all added up to the feeling of stress, isolation, and despair.
The real problem is the manpower. So nurses and specialists are not in enough number to support without cancelling or swifting.
We were requested 2 days ago to volunteer to go help out at the COVID center. So we kind of thought it was our duty to be the first one to apply and to go and give some help.
So at present, we are on double rostering with twice the workload.
We have a lot of people, not in burnout, but almost in burnout.
And there was no respite. There was no downtime to recover or rest. It created a feeling of camaraderie between all the anaesthetists and all the doctors within the hospital, saying this is a common problem that we all have to face together, and we all have to come together to deal with this. And we all supported each other through it.
But when you're really driven by something, you can mobilize energy and enthusiasm that you really is often hard to find. So I think there has to be a balanced way of dealing with the disease, because it's going to be here for a long time.
But sometimes you manage to help people, and that's worth it. It's those very happy times that keep you pushing even when times are not so great.
We are strong as a specialist. We will react as a healthcare system for our patients and for our citizens.
We had this enormous sense of loyalty and comradeship. And I think it's important for our workers to understand that what they do counts.
For the first time, I think the world has realized that the world of perioperative medicine and anaesthesiology and critical care, intensive care, is something that was previously hidden to the world, and it's now come to the forefront, and it's brought up the profile of anaesthetists and critical care doctors right to the forefront of what we do and how we do it. So the importance of what we do has been realized.
We're in the same boat. We have to work together. We have to put our differences behind.
We are proud to be specialists in anesthesia.
If we keep together, we'll get through this.
Keep safe and keep strong.